Welcome to Rebel Health Radio, bringing the best in alternative and integrative medicine to your ears. Well, hello everybody, it's Patricia Warby of Alchemy Therapies, and I wanted to do part 2 on my series on pain because last week I was talking about how the difference between acute and chronic pain and how chronic pain can develop. And I promised you I'd talk a little bit more about the pain amplification process, because chronic pain is a real issue for very, very many people. And modern medicine has very little answer to why it develops and indeed what to do about it. And the problem is that it isn't like an acute pain where you've got tissue damage and therefore you need to rest the area of your body. It's actually more to do with restricting the oxygen flow. So you get very mild, what's called hypoxemia, which is low oxygen delivery to the tissue, which causes all sorts of accumulation of lactic acid and other pain signaling peptides. And so people naturally do limit movement when they're in pain. But with chronic pain, that's actually the wrong approach. And so I wanted to explain a little bit more about that and why that happens. And this is based on chapter 7 in my book, The Scar That Won't Heal, which deals with chronic conditions like chronic fatigue syndrome, chronic anxiety states, chronic pain, any medically unexplained symptoms that modern medicine simply doesn't have an answer for. IBS could be considered part of this syndrome, tinnitus, all sorts of low-grade conditions which can really ruin a person's life, life quality. So last week I looked at nocioceptive pain, which is what I've got at the moment because my shoulder's really damaged, and I fell and I've really hurt the muscles of my shoulder and arm, and therefore any movement I try and make is instantly resisted with pain because it's still healing. So there's a reason for that. But there is also neuropathic pain, which tends to come from sort of more peripheral information fed up to the brain, where the nerves are sending an errant message, either due to this low oxygen delivery or there may be nerve damage longer term. If nerves are deprived of oxygen for any length of time, there is a degenerative effect on the nerves. So there is also a different sort of pain, which this is the one that really causes issues for people because we call it psychogenic. And here, psychogenic pain is produced by parts of the brain not inhibiting the pain signal properly. So we're not saying in any sense that this pain is made up or all in your head or unreal. It's absolutely real. But the origin is not in the tissue itself, but in the processing of pain. And in chapter 7, I had some very useful diagrams, and I refer you to that if you want to learn more. It's all in there. But just very quickly, there is a sort of gating mechanism. There is a way in which pain signals are normally inhibited by your central nervous system, in particular parts of your midbrain, which is sort of at the back, towards the back of your brain in the middle. And the medulla is one of the parts that normally inhibits. And unfortunately, if that fails for whatever reason, the inhibition of pain signals fails to engage, and everything virtually becomes painful. And so movement becomes painful and touch becomes painful. This is a condition called allodynia. And it's a failure of this processing within the brain that really, really doesn't respond to pain, painkillers and pain medication, because that isn't where the pain is coming from. And so if you just reduce the signal, it isn't necessarily going to overturn the pain that you're experiencing. So I thought it was very useful for people to understand these pain pathways. and the interneurons that normally inhibit not working. So first of all, you need to understand it's a real thing. It really causes people a great deal of stress. But why do they get this lack of inhibition? Well, I believe it's due to the stress signal that people are carrying unconsciously. Now, when we look at the type of people who get chronic pain, and indeed chronic fatigue and a lot of the other conditions, what we find is that they have this double whammy of a very high stress in their system, like a very high stress response. They're highly sensitive to stress, and an unconscious program that tells them that it's not safe to feel. It's not safe to feel emotions in particular. And that can sometimes come from past experience, what we call childhood trauma, or it can come from just unconscious beliefs that you're carrying, maybe generationally you're carrying from the people you grew up around, that emotions are not supported and they're not safe. Maybe you weren't supported in feeling when you were young, or you were told to toughen up or not make such a fuss, or you were too sensitive. And so these emotions kind of don't disappear. They build up in the system as a sort of pressure and a stress. And stress is a really real effect in your body that changes your physiology, you see. So high stress with this high stress sensitivity, often all it's looking for in a way is danger. And if you have a situation in your life which tips you over into a high stress response suddenly, like a divorce or financial failure or an accident or an infection, often that is the tipping point. This stress overload becomes too much for the body to hold on to, and the symptoms suddenly appear. Symptoms are really a sign that the body is struggling to deal with something underneath. And people often focus on the pain because, or on the symptom, because that's the easy kind of, that's what the brain tells you to focus on. But in a way, it's a distraction from looking at what emotions you're carrying unconsciously and you're not looking at. And a lot of the brain training programs now for chronic pain, and there are dozens of them out there, look at is bringing unconscious emotions to conscious awareness. And once you do that, you diffuse this pressure in the body that's kind of designing and amplifying the pain. And the pain simply disappears. I mean, it may take months. Sometimes it's immediate. We've had instances of people reading Dr. John Sarno's work, for instance. He was the first to really outline this. But there have been other people since then who've looked at this, and they have designed programs like Unlearn Your Pain is a really well-known one. And just by going through the program and following the instructions, their pain disappears. Now, this is, well, it doesn't make any sense unless you understand the source of the pain is psychogenic and not nocioceptive. So it's a really important point that a lot of modern day illnesses, diseases that your family doctor will be treating you for could be dealt with in this way. And in fact, half the medications that you receive don't actually help because they're not targeting the right thing. Now, I know it's hard to believe, but I'm not the only one teaching this, and I'm not the only one having success with it. So I now know I'm not the only person and I'm not making it up. We really need to understand the burden of unconscious emotion is a real thing. It does exist in every person, and learning to feel your emotions, learning to transmute them, let's say, not just transcend them, not just ignore them, but to actually transform them into something overt, felt, received, validated, is what often transforms people's life from one of pain and dysfunction into one of thriving and joy. This is what I do. I help people process. Now, if that sounds interesting to you, please do get in touch. You'll find me on alchemytherapies, one word, .co.uk. And I look forward to hearing from you soon. Take care, everyone. Bye-bye. Hey, hope you enjoyed listening to Rebel Health Radio. Do subscribe and look forward to catching you soon.